Hello, my name is Alex and I'm your Substance Abuse Wellness Facilitator. We would like to welcome you to the supplementary lessons. These will include additional information for you to identify any added performance inhibitors that may not specifically deal with illicit substances. For today's lesson, we will be looking at diabetes and what to do in a diabetic emergency. Let's get started. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems, such as heart disease, vision loss, and kidney disease. There are three main types of diabetes: type 1, type 2, and gestational diabetes while pregnant. Type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake. That stops your body from making insulin. About 5% of the people who have diabetes have type 1. Symptoms of type 1 diabetes develop quickly. It's usually diagnosed in children, teens, and young adults. If you or someone on your crew have type 1 diabetes, they will need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. With type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. About 90% of people with diabetes have type 2. It develops over many years and is usually diagnosed in adults, but more and more in children, teens, and young adults. You may not notice any symptoms, so it's important to get your blood sugar tested if you are at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes, such as losing weight, eating healthy food, and being active. Gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at a higher risk for health problems. Gestational diabetes usually goes away after your baby is born, but increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen and more likely to develop type 2 diabetes later in life too. Some of the signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine, fatigue, irritability, blurred vision, slow healing sores, and frequent infections such as gum or skin infections and vaginal infections. Too little insulin can cause high blood sugar, hyperglycemia. If it's not treated and gets worse, the person can gradually become unresponsive, going into a diabetic coma. So it's important to get them to see a doctor in case they need emergency treatment. Too much insulin can cause low blood sugar or hypoglycemia. Hypo. This often happens when someone with diabetes misses a meal or does too much exercise. It can also happen after someone has had an epileptic seizure or has been binge drinking. If someone knows they are diabetic, they may recognize the start of a hypo attack, but without help, they may quickly become weak and unresponsive. If you think someone is having a diabetic emergency, you need to check against the symptoms listed below to decide if the blood sugar is too high or too low. High blood sugar, hyperglycemia, warm, dry skin, rapid pulse and breathing, fruity, sweet breath, really thirsty, drowsiness leading to unresponsiveness if not treated. Low blood sugar, hypoglycemia, weakness, faintness or hunger, confusion and irrational behavior, sweating with cold, clammy skin, rapid pulse, trembling, deteriorating level of response, medical warning bracelet or necklace, and glucose gel or sweets. Medications such as insulin pen or tablets and a glucose testing kit. If you suspect they have high blood sugar, hyperglycemia, call 911 straight away for medical help and say that you suspect hyperglycemia. While you wait for help to arrive, keep checking their breathing, pulse, and level of response. If they lose responsiveness at any point, open their airway, check their breathing, and prepare to treat someone who's become unresponsive. If you suspect they have low blood sugar, hypoglycemia, help them sit down. If they've had their own glucose gel, help them take it. If not, you need to give them something sugary like fruit juice, a fizzy drink, 3 teaspoons of sugar, or sugary sweets. If they improve quickly, give them more sugary food or drink and let them rest. If they have their glucose testing kit with them, help them use it to check their glucose level. Stay with them until they feel completely better. While waiting, keep checking their responsiveness, breathing, and pulse. If you're not sure whether someone has high or low blood sugar, give them something sugary anyway, as this will quickly relieve low blood sugar and is unlikely to do harm in cases of high blood sugar. If they don't improve quickly, call 911 immediately. If they lose responsiveness at any point, open their airway, check their breathing, and prepare to treat someone who's become unresponsive. If you suspect an employee has experienced issues related to diabetes, please ask them to immediately stop working and report the incident to your supervisor or the designated representative. Failure to do so could result in injury or even death. The last thing you want them to do is try to tough it out and push through their own symptoms. Remember, the best way to recognize any substance or non-substance performance inhibitors is getting to know the people on your team and being familiar with their characteristics. You have completed Supplementary Lesson 3. Please take a moment to complete the short Lesson 3 quiz and check out the additional resource section for more information. We'll see you next time.
Welcome to your soft field guide. I'm Elena, and we're going to discuss some quick ways to recognize a problem a worker may be exhibiting. These are quick reference videos to help keep your job safe and productive. Let's get started. Have you noticed one of your workers having to go to the bathroom frequently? Maybe they also have increased thirst and hunger, but they're also losing weight. Maybe also irritable and tired all the time? It could be the early stages of diabetes. Diabetes affects 1/3 of all Americans, and it can have a strong effect on your workflow. With diabetes, they can also have high blood sugar or low blood sugar, both of which can have a negative impact and needs to be addressed. Low blood sugar leads to weakness, confusion, trembling, and can be solved by having them sit down to eat something sugary. High blood sugar, which is known by warm skin, rapid pulse, drowsiness, and thirst, needs medical attention, however, and you should call 911. Either way, if you think someone is experiencing issues related to diabetes, it's best to ask them to stop working, call 911, and to report the incident to your supervisor or the designated representative. Well, that's it for this soft field guide. We'll see you next time.